Welcome, everyone. I'm so excited to get to be with you. This topic is just so timely right now. We are seeing the effects of healthcare segregation and racial disparities in so many aspects of the news that's unfolding right in front of us. And I imagine that many of us have seen the effects of racial disparities in health unfold in our own lives as well. I wanted to start, so first of all, is there anyone in this group that is old enough to remember either segregation or the early civil rights movement or anything like that? So basically anybody that might have been alive in the 1960s or before. So one of the main things we're going to talk about in the course is why are things the way they are now and what led up to a two-tiered health system. We have a separate health system for people who can't pay for their own care, and then we have a much better system for people who can pay for their own care through insurance or whatever. And that system very much originated with both medical and racial segregation. Segregation on the basis of class, race, geography in the 19th and then into the early 20th centuries. So what you were talking about, so hospitals could be segregated in a number of different ways. So in this case, there's a physical separation of two different waiting rooms. So that means that this hospital was a Jim Crow hospital, but it admitted patients who were both white and African American, and probably other minorities would have been placed in that ward as well. So does anybody even know what a hospital ward was like in this time? Has anybody ever read those books about Madeline, the little orphan girl in Paris? Okay, so in the book she has, the orphans were lined up in two straight lines on either side of a long room with windows on either side. So that was an orphanage, but orphanages, hospitals, they pretty much were built the same way. And a ward was just a large open room with multiple patients in it. It depended on how large the ward was. But there was very little separation between the beds, and a single nurse could see everybody in the room and would like walk around and take care of the patients. So that's a very old school. That kind of architecture goes back to the 19th century. But in the case of this hospital that Joan was talking about, you could segregate by completely excluding. So there were all white and all Black hospitals. And they were, especially before World War II, most of the hospitals in the United States were run by private charitable organizations, either religious organizations or fraternal or community nonprofits. But there wasn't that much, certainly federally funded and even state and local funded. There just wasn't that many of those around. So that meant that the people running the hospitals had a lot of latitude to exclude who they wanted to exclude. But in the case of the hospital Joan was talking about, since this was, you said it was 19... if it's in the 50s, it's a little bit after World War II. That means the hospitals are getting more modern technology, and medical segregation is increasing. And that means simply dividing the hospital up into spaces by to separate patients by their disease. Or so there's an obstetrics ward, there's a surgery ward, because before, no matter what you were there for, you were just mixed up in one big room. So as hospitals get more complicated, and also as they get more effective at actually curing people, there is both medical segregation, racial segregation, class segregation. So in most hospitals, there would have been, in the 50s, there would have been private rooms for private patients. And this is the way Johns Hopkins Hospital was. There was a private section of the hospital where the food was very good and the care was very good, and it was really like being in a hotel. And then there was the part of the hospital that Joan was talking about, where everybody's in just a big room. And as hospitals progressed, or as time went on, they were the white-run hospitals in the South, like in West Virginia. They were admitting patients of all races, but they were internally separating them in the same way that they separated private from charity patients. So there are all these different axes of separation going on in hospitals. And that's why hospitals got bigger, more complex. They started to have air conditioning. They started to have all sorts of infrastructure behind the walls, like to provide oxygen, or a lot more electrical wiring to support the various kinds of machines that were being used. So after World War II, hospitals get more complicated, but segregation is literally baked into the blueprints of those new, more modern post-World War II hospitals. So that's exactly what Joan was describing. Where did these ideas come from? So today's class is really going to look at scientific racism and the justifications for racial discrimination in health. And a lot of them come from anthropology as well as from medicine. So it's called scientific racism. And of course, now we would say it is unscientific or pseudoscientific racism. But at the time, these very educated, white, middle and upper class academics believed they were being extremely scientific. So the disciplines of anthropology, which, if you know anything about anthropology, it has some very questionable origins in phrenology, the study of the shape of people's heads to determine what their character is. That's where anthropology came from. And, as Darwinism and, Charles Darwin and the better understanding of the theory of evolution, Charles Darwin only applied that to animal and plant species. He didn't apply it to people. But there's a guy named, and I'm getting a bit ahead of myself. I'm going to pull my PowerPoint up. Okay. So people in the 19th century thought in a very hierarchical way. Society, until really relatively recently, it has been divided up into different categories. And there's a new book out called Caste, C-A-S-T-E, that I would highly recommend, that talks about how we've categorized different people around the world. And so this is kind of drawing from that. This diagram, this engraving, is from a book from 1859 called A Biblical Defense of Slavery. And it was written by a Baptist minister. And it was, it got a lot of, thousands of copies were bought across the country, not just in the South. And this minister, I think it's very obvious from the engraving, they believed that white people of European origin were at the top of the racial hierarchy. And then they placed Asians, who would have in those days have been called Orientals, and Africans in the middle. And it might be a bit surprising, but they would place indigenous people at the bottom of this hierarchy. And these scientific racists in the US and Europe, they viewed, and Australia as well, they viewed indigenous people as vanishing races, that they were evolving downward toward extinction. Which is quite horrifying. But so basically scientific racism took both ideas about biological race that go all the way back to the 1500s and the construction of blackness among Africans by white Europeans. They constructed blackness as negative, as justification for beginning the slave trade. And there were religious aspects. So, for instance, calling Native Americans heathens or savages has a very religious overtone, where they're saying basically these are people without souls. These are people who are completely uncivilized. And in some cases, they would, of course, there were some Europeans who tried to convert Native Americans to Christianity, but saying savages and heathens basically was trying to justify the conquering of these people groups in North America. Okay, so we're bringing ideas from anthropology, medicine, and religion into the construction of scientific racism. Now, around the turn of the century, just when the Jim Crow segregation was really solidifying and being written into law. So, for instance, Plessy versus Ferguson was 1896. And that Supreme Court case legalizes separate but equal in segregation with the justification that as long as the separate accommodations are equal, then it's constitutional under the Equal Protection Clause. But of course, it never was really equal. So it was, kind of not really followed. But so at the same time, segregation and disfranchisement were being written into law, the medical profession was trying to figure out who the heck it was and how to do anything other than kill patients. So this is a cartoon from Life magazine a very long time ago. It's right around the turn of the century. And we've got everything from, they've got compulsory vaccination until forever. And then there's also people who are in favor of vivisection, which is the use of animals in medical education. But there's all these different competing ideologies that really don't have much of a scientific basis at all. So our racial ideas, our culture of racism in America, and our the field of medicine as a scientific endeavor, they are evolving right alongside each other, and they are constantly influencing each other. So the person who really pulls the ideas of evolution out of Charles Darwin's notion of the origin of species and then applies them to human beings is so that we get social Darwinism. That would be Sir Francis Galton. And he is really considered the father of social Darwinism and eugenic thinking. And here is what he had to say about human evolution as he saw it. So he thought it's only in children's fairy tales that babies are born pretty much alike. And all you have to do is work hard and be a good person and you will succeed. And that was the Horatio Alger myth that was being published in all these popular novels at the time. But Galton says, I object to pretensions of natural equality. And there are all these hierarchical systems that he is using to prove that, of course, people aren't equal. They end up in all these different statuses, and that proves that social Darwinism is really a thing, that scientific racism is correct. Because if you start with the existing state of things and work backward to justify it, and you're already influenced by racist ideas anyway, you will come up with the idea that this is the natural order of things, and both God intended it to be that way, and science is, in operation here. Okay, so does anyone have any questions at this point? It's a really fast and furious overview of science and racism and the very beginnings of eugenics around the turn of the century. Any questions at this point? There were. So scientific racism really comes to a head in Nazi Germany and in the segregated South at almost the same time. It's a little bit earlier in the South. But these ideas are influencing people across the United States and really in Europe as well. And the Nazis, in fact, are going to borrow some of what they're doing in the Third Reich with, the final solution. They are borrowing some of those ideas from the legalized forced sterilization movement in the United States, which starts in the late teens and early 20s. So this moves us right into, so eugenics was certainly very much alive and well in North America, Europe, and the idea that we want fewer children being born from people with a bad gene pool. And at the time they called it germplasm. They didn't really understand what genes were, but they basically said whatever it is that predestines us to be who we are biologically. Some people have good quality germplasm, and other people have lousy germplasm. And so we want the fit. This, remember, survival of the fittest. We want more from the fit and fewer offspring from the unfit. Now, this drawing really tries to show eugenics as this lovely tree of human accomplishment. So they're talking about all the different disciplines, and here's anthropology, here's statistics, genetics. It's all, eugenics isn't like one of the different roots of this. Eugenics is the whole damn tree. So eugenics is the self-direction of human evolution. So it's a very early form of human and social engineering. I do want to pause though and say, and these result in terrible human rights abuses and even the deaths of people. But I do want you to think that at this time, there is no penicillin. There are a few, if any, vaccines, and a whole lot of people are dying of what are now considered preventable diseases. So one part of the reason why eugenics became so popular is it offered a hope for combating the enormous death rates. So in 1900 in the United States, the white infant mortality rate was 1 in 10 infants died by their first birthday, and then 1 in 5 Black infants did not live to see their first birthday. So these are truly horrific mortality rates. And so that partly explains why people like William Henry Welch, the founding dean of public health and medicine at Johns Hopkins, was a prominent eugenicist. He was on the scientific board of the Eugenics Record Office, which was the main scientific arm of the eugenics movement. But so one of the roots of the tree was statistics. And, you know, at the School of Public Health, we are famous for having coined the term biostatistics in 1930. And so we first had a Department of Vital Statistics, and then it was renamed Biostatistics. And it really, you know, biostatistics is an amazing discipline, and it's the foundation of clinical trials and epidemiology and all these great things. But medical statistics and public health statistics in the early 20th century, it was messed up. There was a really strong racial tone to it. And this guy, Frederick L. Hoffman, was the lead statistician for one of the main insurance companies in the United States. And based on his creation of statistical life tables, in other words, trying to figure out when different kinds of people are going to die so that we can decide how much to charge them for insurance, he took these data that he had collected, and this was just beginning the time when we were getting more accurate mortality statistics that were being collected by health departments. And what emerged almost immediately was there were pockets of people geographically, income-wise, and ethnically and racially. There were certain groups of people who were just dying off at frightening rates. So, and that was because of living conditions, lack of access to health care, many reasons. It was not race, but racism that was killing people at this point. But Frederick Hoffman writes this tome in 1896, Race, Traits, and Tendencies of the American Negro, and his use of all of these complicated statistics. And he is considered a founding leader of the field of statistics and biostatistics. He was a brilliant statistician, but he uses his knowledge for awful things, and he basically justifies scientific racism with the use of biostatistics. So I'm going to tell a story on myself before we discuss a document that's really going to vividly illustrate what scientific racism was. So some people have asked me, like, I am from what's known as the Redneck Riviera, Northwest Florida. It's an extremely conservative part of the country, and it's a not terribly diverse part of the country in some ways too. So how did I end up being interested in the history of civil rights and medicine and public health? So my grandfather was born in 1895, and he was known in Atlanta, Georgia as the Dr. Spock of Atlanta. He was one of the very first pediatricians to practice in Atlanta. So he was my mother's father, and he was a very important person in my life. He was the only grandparent that I knew growing up. The others had died. And it was his influence that made me want to go into medical school. I wanted to be a doctor since I was like 5. So I got a degree in history, and I went to graduate school. I decided after I took organic chemistry that medical school was not going to be a thing for me, but I realized that I really loved the history, Southern history, and the history of the civil rights movement. And so I went to graduate school at UNC Chapel Hill, which is like the best place you can go for Southern history. And I took this amazing class on the history of Southern medicine. And I said, oh, that's it. It combines the things I'm really interested in. So instead of becoming a doctor, I just interviewed doctors and read about doctors and got to read lots of medical journals. And so it really worked out well for me, I think. But what my grandfather taught me, in addition to a real appreciation for medicine and for science, was he was a segregationist. When he practiced pediatrics, he had so we were talking earlier about you can segregate in space within a building, but you can also segregate in time. So a lot of the Southern white doctors' waiting rooms, there would be a particular day of the week that Black patients would come, and that would be their day. And that's what my grandfather did. There were other doctors who had large enough practices that they actually had separate waiting rooms for Black and white patients. And the Black patients would have to wait until all the white patients had been seen. So when I was in graduate school reading all about Southern history and the history of Southern medicine, I was assigned to read this article that I'm going to have you read today. And it's really one of the main reasons why I ended up studying racism and its impact on health and the medical system overall, because I'm really interested in public policy. And so I really am looking at the broad implications for policy and the entire health system of racism. So I read this article in the UNC library, and after I read it, it made me just put my head down on the table and cry. This article was published not in some Southern medical journal, but in the Journal of the American Medical Association in 1910. And it was published at the very height of scientific racism. And I realized as I was reading it that my grandfather almost certainly read it in medical school. He went to Emory Medical School and graduated in 1920, about 10 years after this was published. And especially in those days, it took a while for articles to kind of get out into the world. But I realized that this article had almost certainly informed his ideas about medicine. And it horrified me. I put my grandfather up on a pedestal. I thought he was the most wonderful man in the world, and I wanted to be just like him. And I realized there was a really big ethical hole. I mean, just a huge chasm that I hadn't even been aware of. So let's take a look at that article. What about this struck you or stood out to you, or what did you notice that you'd like to talk about? Okay, so he's saying those are outliers and not to be considered the norm, okay? Possibly he's being influenced by some of that statistical thinking of Frederick Hoffman, who knows? Anyone else? Right. So this paragraph, the very last paragraph on this page, this is just full of ideology from the lost cause in the Civil War. So in order to basically live with themselves and believe that they had done the right thing by joining the Confederacy and leading to the slaughter of thousands, tens of thousands of Americans, as well as that they were benevolent slave owners, white Southern slaveholders had to construct this ideology, or now former slaveholders, that so the lost cause was a very Gone with the Wind version of the South, of benevolent masters and faithful slaves. And, they basically said, African Americans are worse off after slavery than they were under slavery. And that's basically what he's saying here. This, of course, the opposite was true. And while slave owners did have some incentive because slaves were property and they didn't want to destroy their property and they wanted to continue to force slaves to have children so that would add to their human capital, legally, slave owners had enormous latitude to torture and to do all sorts of inhumane things to slaves. And the living conditions in slavery were very much defined by trying to get the most out of people that they could while spending the least amount of money. In World War I and World War II, and also in the Civil War veterans records, there's a clear, there's a height difference, there are weight differences, and there's overall health status differences that are very clear between the white and the black soldiers, mainly because of the enormous level of malnourishment among African Americans that, continued after slavery. But, it was, visibly evident that African Americans had been living in much worse conditions and been much worse nourished than their white counterparts. The article vividly illustrates a lot of what I said in the PowerPoint about the religious threads, the scientific, pseudoscientific threads of the ideology that justified the exclusion of Blacks and other racial and ethnic minorities, exclusion from care, and just, maltreatment. And that, health status is determined as far more by living conditions and economic conditions than it is by being able to walk into a doctor's office or a hospital. And as Joan was just saying, it was jobs, housing, and the emotional stress and the psychiatric, the mental health implications of racism. All of these things were really causing African Americans to need treatment and prevention even more, and yet not be able to get it. So that's where I'll stop for now. Next week, we're going to talk about how especially Black physicians and nurses fought back against this kind of thinking and really helped start the civil rights movement from their opposition to medical discrimination. So thank you so much. I really enjoyed meeting you, and I look forward to seeing you again next week. Take care.